I feel like almost everybody has one of these massage guns. They're cheap, they're easy to use. It really is a convenient way to perform self-massages or to have one of your friends perform a massage on you. Many clinicians use them in their professional practice as well. I've seen them in lots of physical therapy clinics and also in athletic training treatment rooms. But is there any risk when you use a massage gun? We'll talk to a young, healthy college student who dissected her vertebral artery, which caused a stroke after repetitive use of a massage gun. Before we discuss the case, let's talk about the relevant anatomy. The vertebral artery arises from the subclavian artery and runs through the transverse foramen of the upper 6 vertebrae of the neck. After exiting at the level of the first cervical vertebrae, its course changes from vertical to horizontal and then enters the skull through the foramen magnum. Inside the skull, the arteries merge to form the basal artery, which joins the circle of Willis. In total, 3/4 of the artery are outside of the skull. It has high mobility in this area due to rotational movements in the neck and is therefore vulnerable to trauma. Most dissections happen at the level of the first and second vertebrae. The vertebral artery supplies several vital structures in the posterior cranial fossa, such as the brainstem, the cerebellum, and the occipital lobes. The vertebral artery consists of 3 layers: the intima, which is the inner layer closest to the blood flow, the media, which is the middle layer that keeps blood flowing in the right direction, and the adventitia, the outermost layer that gives the blood vessel structure. Dissection occurs when blood accumulates in the wall of a blood vessel. This likely occurs from a tear in the intima, which allows blood to enter the media. Once dissection occurs, 2 mechanisms can lead to a stroke. Accumulation of blood between the media and the intima may occlude blood flow through the artery, leading to an ischemic stroke. The second mechanism is when blood vessel wall irregularities allow formation of blood clots, or a thrombosis, which can cause an embolism, which is a migration of the thrombosis of those clots to the brain. With vertebral artery dissection, thrombosis and embolism seem to be the predominant issue leading to stroke. Vertebrobasilar insufficiency symptoms after vertebral artery dissection can be remembered by 5 Ds and 3 Ns. The 5 Ds include dizziness, diplopia, dysarthria, dysphagia, and drop attacks. The 3 Ns include nausea, nystagmus, and numbness. The annual incidence of dissection is about 1.1 per 100,000 annually in population studies from the US and France. Carotid and vertebral artery dissections account for only 2% of strokes, but they cause 10 to 25% of strokes in young and middle-aged individuals. Treatment focuses on reducing stroke episodes from the distended artery. The 2 main treatments involve medication: anticoagulation medication such as heparin and warfarin, and antiplatelet medication such as aspirin. Occasionally, thrombolysis, angioplasty, and stenting may be necessary. Rarely, surgery, including arterial repair procedures, has been described in the literature. Meet Lily. She's a graduate student at the University of Mississippi. She's very active, no prior health issues, and she's not taking any medications. Occasionally she had neck pain from all the hours studying. She was given a massage gun as a Christmas present. Unfortunately, she dissected her vertebral artery and suffered a stroke after using a massage gun. Unbelievably, she isn't the only one this has happened to. Solkowski and colleagues in 2022 describe a case of vertebral artery dissection after using a handheld massage gun. Lily was gracious enough to get on a Zoom call with me and tell the story about how she suffered a stroke after vertebral artery dissection. And here is her story.
Well, hey, thanks so much for getting on here with me and telling me this crazy story.
Yeah, of course.
Happened to you. It's just insane. First,
I know.
I'll show
So
you
crazy.
this. And
Okay, that looks very similar to the one I had.
you like have a near panic attack seeing it?
Oh yeah, I threw mine away. As soon as I got back home, I threw it away.
Oh my gosh, that's insane. So if you will, just tell me what happened. It's a pretty gnarly story.
Yeah, pretty crazy story. So at the time I was a graduate student for the University of Mississippi, and I had gone to a work conference in Greeley, Colorado, which is like hour and a half outside of Denver. Presented the first day, everything went well, felt fine. I went to bed that night. I did notice a little bit of neck pain, like right in here, but
Okay.
it was, nothing that I was really concerned about. I didn't even need to take like ibuprofen for it. Woke up the next morning around 6 a.m., started going through emails, finishing up some school work for about an hour. Then I started getting ready around 7 a.m. And all of a sudden, my left hand, as I was putting on mascara, went completely numb. And I thought, maybe I'm just cold. In Colorado, it's snowing today. I mean, maybe I'm just, bad circulation. So I put it under hot water for about 5 minutes. Didn't help whatsoever. Then it started slowly going up my arm. And then I started to feel this pain in the back of my neck, which still wasn't really concerning. I was more concerned about the numbness.
Yeah.
And then as I started to pack up my suitcase, it's the last day of the conference. The plan was to go there, eat breakfast, stay until noon, and then fly back home to Memphis.
Yeah.
And as I was packing up, I kept like almost falling over. I started to lose my balance. And it was really weird because, I felt like I was hydrated. I'd eaten, everything was fine. So then I'm like going down to the lobby with my suitcase, kind of like leaning on it. And I tell so there were two professors with me. One who I'm really close with. I thank her for basically saving my life and sending me to the doctor in the first place. And then another doctoral student. And so I told them, I said, I feel like I have a pinched nerve or something in my shoulder. I don't know what's wrong. I've tried to stretch it and it's not like I'm not getting any relief. And my arm is just numb, like completely numb. And they were like, well, maybe you just need some food, some coffee, coffee would probably help you.
Yeah.
And so we get to the conference and one of the professors I was with was like, you might be having a migraine.
Yeah.
So we thought, maybe once, I'm hydrated, get some caffeine, maybe I'll be fine. Well, that was not the case. And I was sitting there and all of a sudden the numbness starts going up my neck and into my face. And I'm like, okay, maybe I should go to the doctor. Maybe something's wrong.
Yeah.
So, and then at one point I even stand up. I can't remember if I was going to the bathroom or to get water, but I looked at somebody and I go, oh, I'm about to pass out. So I had to sit back down because I was so dizzy. I could, barely walk and go to a walk-in clinic. And from there, they were just kind of worried about my blood pressure, wanted to do an EKG there in the walk-in clinic. And I was like, that's fine.
Was it
And then,
high? Was it high blood pressure?
yeah. So I went in with high blood pressure. It was like 169 over 106, which is pretty high for a healthy 23-year-old.
Yeah. Yeah.
And I've always kind of told myself I have white coat syndrome because I'll be completely fine at home. And then when I'm at the doctor's office, it kind of shoots up maybe to like 140 over like 90.
Mm-hmm.
But still, it was really, really high. Again, for my age, I guess. And she told me, the nurse practitioner there, we're going to do an EKG in the office, maybe check again on your blood pressure. And I was like, okay. So I get up off the doctor's table to sit on a stool and I nearly collapse over. And then she goes, I think I might just send you to the ER instead. So I end up in the ER in Greeley, which is this very small town. There's nothing there.
Yeah.
And then I get to that ER and I'm there from probably around 10, 11 in the morning until 1 a.m. the next day, 12 midnight, 1 a.m. the next day because of all the tests they were running. And first test they did, I believe, was a CT and then a CT with contrast. And then I went in for an MRI a couple hours later. So I think with the CT, they saw maybe the blood clot at first.
Mm-hmm.
The CT or MRI, I'm not sure which one they caught it with. And then what they thought were lesions on my brain. So there at that hospital, they were very concerned about MS and thought, that's the issue, that's the problem.
Yeah.
So I got started on steroid IVs.
Mm-hmm.
And a couple hours after that first steroid IV, which was pretty strong, nothing had changed. I was still very numb. My balance was getting worse.
Yeah.
They wouldn't, let me stand up on my own. I had to, have somebody walk me to the bathroom. And I took a sip of my water at one point and the water bottle just flew out of my hand because I had no control over that left side. And once they realized that the steroid didn't help, they decided to transfer me to Swedish Medical in Denver,
Mm-hmm.
which is a phenomenal hospital. The one in Greeley was as well, but this one has a stroke unit, and I had 4 to 5 neurologists working with me the whole time I was there.
Mm-hmm.
And I would say probably the next morning, after I'd gotten there, the next morning, they had realized that it wasn't MS, that I'd had a stroke, and it was caused by the dissection in my left vertebral artery. Crazy.
Dang. Yeah. Yeah. It is crazy. Differential diagnosis on somebody young and healthy like you presenting with those
Yeah.
symptoms is pretty vast. I mean, it can be something as crazy as a tumor. I'm sure that at one point they probably thought you were on some kind of drugs. They did a bunch of drug screens on you. I'm sure. Like, this
Yeah, and
is
they even
all
asked,
these meds.
since they saw the dissection in the neck, they were concerned about some sort of injury and kept asking me, have you been strangled? Have you been in a car accident? And then they came back again and said, are you sure you haven't been in a car accident that you don't remember? And I was like, I'm pretty sure I would remember.
Yeah. Yeah.
So
Yeah.
it's crazy.
Dissections, usually would have a certain percentage of them. Like 1 in 4%, I was just reading, the vertebral artery dissections can be spontaneous, but most of them, like up to 25% of them, are traumatic. So like a whiplash or a
Yeah.
fracture manipulation or literally like somebody freaking strangling you or something
Yeah.
can cause those things to dissect. It's really, really insane. So when did you start using the old gun before all this stuff happened? Like when did this come into
So my sister got me one for Christmas, this past Christmas, and I probably started using it right around January. I didn't use it consistently every day until probably the beginning of March. I'd started having some neck issues, which wasn't a big deal for me because I played sports growing up, and I've always had, neck, shoulder issues, muscle spasms, whatever.
Yeah.
And probably consistently around the beginning of March.
Okay.
And so the stroke happened on April 4th.
Yeah. Yeah. And when you were
Or
using
no,
it,
April 5th, maybe. I can't remember.
and you would
April
put it
4th.
like on the side of your neck, the base of your head, like all around your trap,
Yeah.
all that
I
kind
would never really use it on my head because, common sense, that was like, maybe I shouldn't do that. But, the neck seemed fine for me, but obviously not. And it took me a while and the neurologist to kind of realize what had caused it. Because at first they said, it's obviously spontaneous. You haven't had a car wreck. You haven't been on a roller coaster. You haven't jumped out of a plane anytime soon. And I was like, a couple hours later, it kind of hit me. I was like, wait a second. Some sort of trauma to my neck. Something had to be pretty, harsh on it. And I was like, I've been using a massage gun for the past few months.
of. Hmm.
And the neurologist looked at me and said, that's it.
Yep. And it's crazy. So this was you're obviously the first patient around here that we've seen that had this happen to him. But just
Yeah.
a quick Google search, I instantly found a case study of a 27-year-old that this happened to, that had a vertebral artery dissection from using a massage gun. So it's just wild. And so I have this massage gun that came off Amazon. It's like $30. It's been in my
Yeah.
room for a while. I never use it. I pulled it out just because I knew I was about to jump on this Zoom call and I wanted to, have it for the Zoom call. But I hurt my back a little bit in the gym this morning. So I was like, well heck, I got this massage gun now. So I put it on my low back. But the reason why I say that is because I was doing this on a low setting in my low back, and it vibrated all the way up to my head, like it was making my ears tickle. And
Yeah.
that's way on my low back. So you think about just that, even at that low setting, like if I had this anywhere near any of the vasculature in my neck, if I can feel a vibration from my butt up to the top of my head, you can imagine how much force is
Right.
at these some of this neck vasculature that can be susceptible to trauma, like
Yeah.
vertebral arteries. So yeah, it's just insane.
It's crazy. But I mean, I don't really have a negative outlook on it. I've tried to stay positive because everybody else I've seen, their case is much worse.
Yeah, yeah,
I mean, I finished PT and OT OT because I didn't even have to do PT when I got home,
yeah.
but within a month.
Right.
Yeah.
which is amazing because sometimes even in young, I mean, we'll have 14, 15-year-olds that have strokes. Sometimes they have brain bleeds, and they're just completely, I hate to say the word crippled, but they're just can be crippled,
Yeah.
like be in a wheelchair. And with a vertebral artery, you stroke out the posterior loop of your brain, you can't even stand up. I mean, you just fall
Yeah.
over. Like, I mean, so yeah, in a crazy circumstance, as my dad would say, you came out of this smelling like a rose. You
I
really
did. I did.
Do you have any residual effect, or are you kind of completely back to what you would consider your normal now?
There's still some effects. My left side is still not completely numb, but I've gotten a little more feeling back, not completely. Um, my strength is pretty much back on my left side. I just have to be careful. I'm not supposed to lift more than like 5 to 10 pounds.
Yeah,
Um, just no straining that neck back there. Migraines are probably the biggest side effect, but I've been put on like preventative migraine medicine. At first, it was, wait till you get a migraine, then take the medicine. And so I would take it twice a day now, which is a lot better.
yeah. Are you
And
still,
then I would say which is not as bad as some people would think, but my short-term memory is still kind of,
mm,
you know,
you
and
can,
I've noticed
uh,
too when I speak to people and they ask me a question, it'll take me like 0.5 to 1 more second to, get it out of my mouth than it would have beforehand. I
yeah,
kind of have to, like, it takes a little second.
right. Are you still on any kind of blood thinner, or did they take you off of blood thinners?
I'm still on blood thinners, Plavix and aspirin as well.
Yeah, yeah. You
I
know,
know from reading like most of the research, which there's not much on it, but most of the patients who did not have a stroke with the dissection are only on aspirin, I think.
mhm.
But I think since I've already had a stroke, on both.
Yeah, yeah. It's gnarly when you think about a vertebral artery dissecting. Like you just think it would just like tear, and then all of a sudden you're just bleeding out into your neck and brain.
Yeah,
But as you'll see on this video, whenever I'm done with it, like it's crazy how it just like layers of the artery tear, and then it just kind of creates a pouch which can collect blood, which clots, and then you basically throw a clot, and that's what causes you to have a stroke. So,
yeah,
and even in all the years of school, and even in all the neuroanatomy that I've had, like somehow I freaking missed that. Like when we were talking about the vertebral artery, I just didn't know that's how vertebral artery is dissected. That's why, I wanted to share your story and kind of give you, have a platform that you could tell your story because listen, everybody has one of these things. Like even physical therapy clinics, I travel around and I teach lots of continuing ed to physical therapists. Almost every clinic I go to
yeah,
has these things, and they use them on patients. I've seen them use them on the back of patients' heads and neck and stuff. It's really something that we need to kind of pump the brakes a little bit because some weird stuff
yeah,
can happen with this little gun.
yeah.
It happened to you. You're not the only one. There's some case studies in the literature about this very thing happening. Uh,
Right. I think I found at least 2 case studies with I think a 27-year-old, 28-year-old, the
yeah,
same thing. But it's pretty ironic that you mentioned that because whenever I was leaving the hospital and I was walking around in the gift shop waiting on an Uber, there was a whole wall of massage guns that they were selling. And, that was just funny to me because that's the whole reason I was there.
oh my
But
God, I
anybody
can't
that I
even believe
see
that.
now and I know that uses one, I tell them do not use it on your neck.
Oh my gosh, that is the best part of this story. The hospital was selling massage guns.
Yeah.
Oh my goodness. Well, Lily, you're such a sweet girl, and it's been great talking with you in person and then over this Zoom. Just thank you so much for sharing your story, and I'm so thankful that just like I said, you came out of this smelling like a rose, like you came out of this so good and still healthy, and you have your health and your mobility, and so I'm thankful for that. And I know that you finished in grad school and about to start teaching, so I'm excited for that new journey that you're about
Yeah.
about to start taking.
Thank you. I'm excited.
It's gonna be great. Just no more massage guns to the side of your neck, and then no more
Right.
no more strokes.
Right. And I just tell myself all I can do now is raise awareness for it.
Yeah, yeah, exactly. Well, thank you so much for sharing your story.
Well, thank you.